Hello everyone. In this presentation, we would like to take a quick moment to teach you about antibiotic resistance. This presentation is brought to you by AWARE. AWARE stands for Alliance Working for Antibiotic Resistance Education, and we are a student group at the University of the Pacific Thomas J. Long School of Pharmacy under the organization CSHP. Our mission is to raise awareness about antibiotic resistance, and during this video we will teach you about antibiotics and its uses, antibiotic resistance and its characteristics, and how we can prevent it. All information can be found through the Centers for Disease Control and Prevention website, otherly known as CDC, and the World Health Organization.
Antibiotics are medicines that fight infections caused by bacteria in humans and animals by either killing the bacteria or making it difficult for the bacteria to grow and multiply. They are important to treat infections and have saved countless lives. Antibiotics only treat certain infections caused by bacteria. They do not work on viruses. Antibiotics are also not needed for some common bacterial infections, such as many sinus infections, because these illnesses will usually get better on their own without antibiotics. These infections may be self-limiting, but patients should see their healthcare provider if their symptoms worsen. Taking antibiotics when they're not needed won't help you, and their side effects can still cause harm.
Antibiotics are one of the most commonly prescribed types of drugs. The most commonly prescribed antibiotics are listed here with their generic and brand names. Amoxicillin, also known as Amoxil, azithromycin, also known as Zithromax or Z-Pak, amoxicillin in combination with clavulanic acid, also known as Augmentin, cephalexin, also known as Keflex, and doxycycline, also known as Dorix or Vibramycin.
What is antibiotic resistance? Antibiotic resistance occurs when bacteria develop the ability to defeat the drugs made to kill them. This results in the continuous growth of bacteria since the antibiotics can no longer work properly and kill them. This resistance occurs because bacteria constantly try to find new ways to beat the effects of the antibiotics used to treat the infections caused by them.
Each year, over 2.8 million people in the U.S. have infections caused by antibiotic-resistant bacteria or fungi. These infections can be quite hard to treat. They often require expensive and toxic alternative medications, as well as long hospital stays. Antibiotic resistance poses a big threat to modern medicine. Many medical procedures and treatments rely on being able to use antibiotics to fight infections to make them safe. These include surgeries, cancer therapy, treatment of some chronic diseases like diabetes and asthma, and more.
Bacterial versus viral infections. Bacterial infections are caused by bacteria, which are living organisms that can thrive in various types of environments. Bacterial infections are localized, so they are usually confined to one area or part of the body. Only antibiotics can treat bacterial infections because these drugs target the specific bacteria that is causing the infection. On the other hand, viral infections are caused by viruses, which are submicroscopic infectious agents that require living cells to reproduce and spread. These infections are systemic and can spread to various areas of the body. Treatment for viral infections are antiviral medications and vaccines, although vaccines are considered more for preventative measures. It is important to note that antibiotics cannot kill viruses, so they will not help against a viral infection and could even increase the chances of developing an antibiotic-resistant infection.
As provided by the World Health Organization, these are only some of the causes of antibiotic resistance. Listed here is overprescribing of antibiotics, patients not completing antibiotic therapy, overuse of antibiotics in livestock and fish farming, poor infection control in hospitals and clinics, lack of hygiene and poor sanitation, and lack of new antibiotics being developed.
There are many different types of symptoms that can be displayed based on the type of bacterial infection that a person has. Here are some examples of the type of symptoms that are displayed when someone has an antibiotic-resistant infection. First, life-threatening bloodstream infections can be caused by resistant species such as Candida. Second, life-threatening diarrhea can be caused by antibiotic-resistant bacteria such as Clostridium difficile, in which patients may produce watery diarrhea 10 to 15 times a day. Third, staph infections are caused by bacteria found on the skin or in the nose, which can penetrate the skin through cuts and scrapes, and can cause red and inflamed bumps to form on the skin. And lastly, bacterial pneumonia can arise from bacterial infections such as Streptococcus pneumoniae, which can target the lungs and is extremely contagious and can be passed on by coughing or sneezing.
A couple ways that we can work together to prevent antibiotic resistance is first off, preventing infections in the first place. Make sure to wash your hands, get your immunizations, have proper food preparation, and use antibiotics only as directed. Another way is tracking. This helps develop strategies so that we can prevent antibiotic-resistant infections in the future. Improve antibiotic prescribing, only using antibiotics when actually necessary. And finally, developing new antibiotics. Bacteria is always evolving, so all we can do is slow it down and continue making new antibiotics.
We hope we were able to teach you a little bit about antibiotic resistance and would just like to leave you with a few important takeaways. One of the best ways to prevent antibiotic resistance is to prevent the spread of infections. Please practice good hygiene, such as washing your hands often with hot water and soap for at least 20 seconds. This is around the amount of time it would take you to sing the happy birthday song twice. While COVID-19 is not a bacterial infection, the same practices can be used to prevent the spread of bacterial infections, such as covering your mouth and nose when you sneeze or cough, and wearing a face mask or other facial covering, along with practicing social distancing when you go outside. If you are given an antibiotic by your doctor, please finish all of your antibiotics as directed by your doctor or pharmacist, even if you start feeling better halfway through treatment. If you have any questions, you can visit the CDC or WHO websites for more information regarding antibiotic resistance, or feel free to contact any of our AWARE co-chairs at the emails listed here. Thank you for your time, and we hope you and your loved ones stay safe and healthy during these times.